This next chap is Professor Chris Doran. We had a chance to work with Chris yesterday. He's a health economist. I think would that be a fair description, Chris? And is doing some really interesting work around some of the questions that are being asked around the cost of what's going on here. And Chris is, in one way, a world expert, I suspect, and he's done a lot of work for the World Health Organisation, for the United Nations, and so it's great to have someone of Chris's quality with us. So please make him welcome. Has the same haircut as Chris Lockwood, obviously goes with it.
Thanks very much. I'd also like to thank John and Jorgen and Peter for letting me come up and present some of this work to you guys. The title of my talk is a little bit different to what was in the conference brochure. It's more a return on investment exercise that I'm doing for Mates in Construction. So I'm going to take you through some of the steps involved and some of the research that we've been doing to do that project. I'd also like to just acknowledge where I'm from, the Hunter Medical Research Institute. It's a not-for-profit organisation. It does a lot of work with and for community, and it's affiliated with the University of Newcastle and the Hunter New England Health, so we do a lot of work with doctors and local policymakers. And I'd also like to acknowledge my co-workers on this project, Dr. Rod Ling and Kim Edmonds. So I almost took this slide out because I thought most people knew about Mates in Construction, but over lunchtime conversation, there's a few people that don't. So I thought I'd just have a quick overview of what Mates in Construction is all about. And for me, I'm relatively new to this area. I do have a mental health background, but suicide is a relatively new thing for me, particularly in the construction industry. So Mates in Construction operates in 4 states. It has 3 main components, training components, the general awareness training, connected training, assist workers. So one of the issues here, on the first one, general assist awareness training, a site is compliant when 80% of the workers have conducted the training levels. And as you can see down below, accredited sites are also provided with additional materials and support and the 24/7 hotline, I think. So Mates in Construction, in New South Wales, they're thinking about rolling out the program to 140 sites across the New South Wales building and construction industry. So to help cover the costs of this, Mates in Construction are thinking about a social impact bond. So a social impact bond is a relatively new concept in Australia. It's been going in the UK for a few years. And essentially, it's a contract where a public sector agency, such as the New South Wales Government in this case, engages the services of a private sector to fund and conduct a project, hence the Mates in Construction. So a key part of the application is the goals are set which should benefit society and save the New South Wales Government money. So it's a way in which you can fund a project and it's a win-win situation for everyone. But there's conditions for that application. A bond application requires consideration of the cost of the government, and in this particular case, what's the cost of suicide to the government? What's the cost of the proposed intervention? What's the cost of rolling Mates in Construction out across those 140 sites? What's the estimated impact of Mates in Construction? The hard impact is reducing suicides. What's the potential savings of the New South Wales Government? And what's the estimate of investor returns? So in a nutshell, this is a diagram that they use in the social impact bond proposal. And essentially it comes from having an understanding of the status quo. So in this case, the status quo is the cost of suicide to not only the New South Wales Government, but to society, individuals, families, the industry. So at the end of the day, the government is saying, okay, we'll fund this proposal if it saves us money when we cover all our costs. The cost being the cost of delivering the program, the cost of investors, and we also want to take a little bit of an extra cut for ourselves because we're in such a black hole. So this is the whole premise behind a social impact bond. It's an attraction for wealthy investors to put their money into a social program that's beneficial to society. So we've just been talking to Jorgen over the last few weeks really about this, and we've only started the project this month. And part of our plan of attack was to look at what's been done in the past. So as a researcher, we wanted to look at the evidence. What's the evidence on the status quo? So part of that, we went back to look at the stats on suicide. So we've had a few slides, a few of the presenters talking about suicide rates. The Australian Bureau of Statistics put out regularly information about suicide rates, and there was a talk before that said around 2,300 suicides each year. 4 out of 5 of those are males. So when you look at stats like this, it really hides a lot of the picture. You have to drill down a little bit deeper. We know suicide rates differ by occupation, they differ by geographic region, they differ by socioeconomic status. So we started to look for this information. Unfortunately, the ABS have ceased producing information on suicide rates by occupation. So they do it by states, but they don't actually do it by occupation anymore. So we found some past research, and my understanding is some of the research is why Mates in Construction actually was established as a consequence of that data. And again, John talked about this before, I think, in terms of the Australian Institute for Suicide Research and Prevention conducted a study where they actually combined a whole range of data sources from Queensland Death Registry and other super funds to calculate suicide rates and compared them to the relevant population. So this is a bit of a messy slide, but it's similar to what we saw in Chris's presentation. It's just presented a little bit differently. So essentially it's a comparison of the rates of suicide deaths per 100,000 population for the construction industry in Queensland, for Australia and for Queensland as a whole. So this is a little bit out of date information, but it sort of it's consistent with what Chris presented in the last 2 presentations before, that the rates are a lot higher in the construction industry. And as I said, this was one of the key levers by which Mates in Construction were developed. Not necessarily from the industry realising that it was a huge problem, it's a costly problem and they had to do something about it, but the fact that the evidence is demonstrating that there is a huge problem. So again, part of the homework we wanted to look at, not just suicide, but suicide behaviours. So we know there's some stats presented down here, and again, we've been talked to, Sue mentioned this before. For every day, 6 people die by suicide in Australia. 180 people attempt suicide. So there's a whole heap of people that are trying to kill themselves and aren't successful. 80 people admitted to hospital from self-inflicted harm. So when we're looking at the return on investment for the Mates in Construction, it's not just about saving suicide, it's not just about saving people from killing themselves, it's about reducing the propensity or willingness to self-harm. So when you think about the economics of that, the next slide talks about some data from the New South Wales hospitalisations on intentional self-inflicted harm for males and females over time. So females, actually, it's a little bit different to the suicide rates, more males, 4 in 5 males suicide, but these data indicate that more females are trying to, self-harming, being admitted to hospital for self-harm. So it's changing over time, there's an increase over time, and when you add these up, it's around 10,000 admissions to hospital each year in New South Wales alone for self-harm. So it's a significant problem, not just suicide, but suicide behaviour as well. And this is the tip of the iceberg. When you start adding in mental health, people with mental health problems seek services a lot higher than normal, than people without mental health problems. They have a lot more time off work. It's a cumulative effect that is a huge cost. So the next part of the exercise is we wanted to try and look at the impact of suicide. And again, this is a common theme throughout the morning session. So while suicide is considered a relatively low prevalent event compared to the cancers and cardiovascular diseases, when it occurs it has devastating and widespread impacts. So we talked about the multiplier effect, and there's some evidence to suggest that some of the studies range from it's a multiplier of 6 people for every suicide, but some of the stuff coming out of the US, for every suicide, up to 28 people. So it has huge implications, and I don't really need to expand on that too much. One of the issues here, potentially 3 to 4 generations can be bereaved, siblings, parents, grandparents. So we've heard some stories about the implications of that. So getting to the cost information. So again, as a research, we looked at the evidence out there. There's really not much there, and what is pretty patchy. So there's some studies from the Ireland, US, New Zealand, UK and Australia, and they all tend to rely on each other. So the New Zealand worked out a cost for police time going to a suicide. All the Australian studies use that estimate. So it's a pretty lazy attempt, and there's different methodologies. So the costs of those exercises generally include direct, indirect and intangible. So the direct costs are costs associated with explicit monetary outlays. Medical costs, policing costs, forensic costs, funeral costs and counselling costs. The big ticket items for economic costing studies are indirect costs. So if you think about a person that dies when they're 25 and they're employed, they have, so what's the example up there? Someone dies at 20 years and retirement age is 65, then they've lost 45 years of potential productivity. So from an economic point of view, they take the average wage of that person multiplied by 45 years. So it's around 98% of all costs are comprised of indirect costs. The intangible costs, we haven't really got any idea how to put a dollar value on that. Some studies have, but it's pretty dodgy. So in a nutshell, here's some examples of the cost of suicide from those studies that have been, I mentioned before. The moral of this story is they're billions of dollars. It's a huge cost to society. And it's a bit of a hodgepodge sort of mixture of what they've included and what they haven't. So some of the Australian ones, we've got average cost per suicide of around $6 million per person, compared to the New Zealand estimate, if I can see that one, wherever it is, up here, is around 2.4. So a bit of a difference there, you know, $2.5 million difference. And it comes back to the methodology, what they've actually put together. And there's some studies that looked at the cost of per suicide attempt ranging from $17,000 to $27,000. But you can't really compare them. The magnitude highlights the significant impact it's having on society, but because each study varies in methods and cost categories, it limits comparability between those studies. So when we took a step back and thought about the purpose of our brief, what seemed to be missing from the cost studies are industry-related costs. There's very little information from an industry point of view about the cost of mental health and the cost of activities that they undertake to try and prevent or minimise mental health. So the major cost studies, they don't include the cost of training, education staff, occupational health and safety. I know that's a big issue in the industries these days, particularly around safety. There's not too much, from my understanding, around the mental well-being and psychological aspects, but that will change. The cost of treating self-inflicted harm on site, no mention of that. Compo claims and admin processing costs, that was my question to Chris. There's no information in the literature. So there's probably internal reports that we haven't been able to access. So it's about trying to dig that out and do a better job. Lost production costs due to a shutdown. Again, there's been reports when a death occurs, the whole place shuts down. That has huge implications for an industry. There's been no consideration of that. Case management time, insurance premiums, post-vention counselling costs, lost investment in social capital. So there's a whole range of cost categories that haven't made it to the print as yet. We know from other studies that mental health has major impacts on workplaces. So there's a recent study, and again, we talked a little bit about this before, the OECD, the Organisation for Economic Cooperation and Development, developed countries, I think there's around 32 countries involved. They estimate that as many as 20%, so 1 in 5 of the working age population suffer some sort of diagnosable mental health condition. So suicide, mental health is a huge beast. Suicide is one component, it's related to a number of these conditions. 1 in 5 of the working age population, that's massive. There's an Australian study used Health and Performance at Work questionnaire to examine the relationship between psychological distress and workplace productivity, and he demonstrated what we've been talking about, that if you have a psychological problem, it impacts on your productivity at work, it impacts on your performance, impacts on a whole range of things, absenteeism, presenteeism, and they estimated that the psychological distress produces a $6 billion reduction in Australian employee productivity per annum. So big numbers. again, there's not too much from a particular industry's point of view. These are just big national estimates. I did a review for the New South Wales Mental Health Commission to assist them develop their strategic plan. And I'm not going to talk too much about that, but essentially what we did is the same sort of exercise, reviewed the evidence on the impact of mental health conditions on the economy and productivity of workplaces. And several experts pointed to the need for workplaces to become better equipped to handle psychological stress within their own companies. And again, this is what the experts are saying in the field, and again, it's been resonating throughout you guys today. If employers were more aware of the economic consequences of the impact of mental disorders on their employees, the workplace could provide an ideal setting for mental health promotion and prevention. And again, this author that I mentioned before, Hilton, suggests that effective treatment for mental health problems yields substantial increases in employee productivity and would be a sound economic investment for employers. But again, I found no evidence at all about an industry estimate of how much mental health costs them. We spend a lot of money on safety, reducing accidents. Accidents cost money, so it makes sense. Mental health costs money, so why wouldn't they do that? It's a sound economic investment. So mates in construction are filling this void. Anecdotal evidence suggests that it's effective, cost-effective, it's acceptable, it's feasible, it's out there, it's doing it, and provides a good return on investment. So I suppose my job is to then, where to from here? So our brief is to look at the return on investment of mates in construction. So we've got some data that's available from the peer review from different government agencies, but it's pretty patchy. So what we have to do is start from scratch and build up our own estimates, which are credible, reliable, and based on primary data where possible. So hence, I really like that presentation by Chris in terms of looking at the suicide rates, really gold standard data in terms of it's the industry data used for an industry purpose. So if you can actually put some dollar values to that, it would be really useful as well. So this is the next point in terms, we need to work closely with the industry to identify appropriate data sources. We've identified a whole range of cost categories that there's no consideration of at all. Death, accident data, compo data, accident procedures, shutdown implications, employee wellbeing and productivity measures. We also need to unpack the mates in construction to work out how the outcomes in terms of reaching workers translates into avoiding deaths, avoiding harm. So mates in construction, there's a lot of measurable outcomes in there, but at the end of the day, we have to try and translate that into deaths. So how many deaths are we going to avert? How many accidents are we going to avert? So that's a challenge for us. Once we have a cost estimate, we can estimate the potential savings from mates in construction. And again, the bond proposal is focused on the New South Wales government, but we're taking a bigger picture. We want to look at the impacts on the individual, the family, the industry, as well as the government. So we can take it to the government. So you guys might benefit this much, but society will benefit this much from this program. So in terms of the ripple effect, it'll have a positive impact, hopefully. So each of these steps require consultation with mates in construction and the industry to collect the data. And I think I've finished. Thank you very much.